Well, even though we know people can improve with attending physical therapy or chiropractic care in the clinic and then transition to that independent home exercise program combined with the hip track, we know that arthritis will continue to get worse. I have people that come in, they were supposed to get a hip replacement 2 years ago. And they say, you're curing my arthritis. My pain's a 1 out of 10. I'm doing yoga twice a week and hiking again, and I'm just so thankful. I use my hip track. I love it. And I say, well, I am truly happy for you. However, your arthritis is probably worse now than it was 2 years ago. And they just have a hard time understanding how can that be, because it feels better. But we just have to really educate people to keep working as long as they can, and eventually that hip is going to get worse to the point where there's nothing I can do, there's nothing the hip track can do. The conservative measures will be exhausted. So that time, they usually have a relationship with a surgeon. We help them find a surgeon and get educated about that. But the great thing is we're delivering people to the surgeons that are in better shape, less pain, and we just hope that when you go into any surgery in better health and condition, that's got to have an impact coming out of surgery and recovering from surgery. So at that point, we'll get them through surgery. And then after surgery, they'll be stiff and weak, the typical, post-surgical pain and whatnot. So then we'll pull them back into physical therapy, get them going through those new exercises so they can strengthen that hip back up and then get back into life with their hip replacement. Hip replacements are that's the gold standard for treatment once the conservative measures have been exhausted. And nowadays, it's not like it used to be. Hip replacements now people can just do a lot of great things. We have people, you're playing tennis again, you're hiking, you're skiing and snowboarding again. It's not like it used to be 20, 30 years ago. So we don't want those people to suffer too long. So if they're really trying to put it off and they're just miserable, I just really tell people, look, it's time for you to have surgery. You've done great, you're ready. We'll get you through it, and let's get you on with just really enjoying your life.